Tēnā koe, ko Peter Jansen taku ingo, e uri hau no Ngāti Hinerangi me Ngāti Raukawa. Well, I was born in Hamilton, not far from where my people come from. Our marae is just outside Matamata, Ngāti Hinerangi and Ngāti Raukawa are my iwi. I'm the Tumuaki, the Chief Executive of Te Tahu Hauora, the Health Quality and Safety Commission. I started in May 2023. You're a leader in the healthcare system and you want your system to meet the needs of all your consumers. Their families, you want it to be effective, you want it to be efficient, you want it to deliver on the requirements of our communities, as well as professional standards. This policy is more reflective of Te Ao Māori views. That's because Te Ao Māori looks at relationships between people and events and time more closely. And this policy sees the restoration of those relationships at its centre. As leaders, we need to demonstrate how this will work. We want to have a restorative system, that is, when things don't go as planned, consumers have a swift response to the issue. They're able to be supported to recover. They can make complaints that are thoroughly investigated, and they get information in a timely way that meets their needs and improves the system. Have a think about if you were in the shoes of a consumer when things went wrong. You'd want a swift response so that your health was restored to the maximum extent possible. You'd also want the system to thoroughly investigate what happened and make changes so this wouldn't happen to other people in the future. If we can extract important lessons out of our reviews and apply them immediately in practice, we'll get a better result. The health system in New Zealand has been on a big journey of change, which involves centering the voices of consumers, the people who use the system and their families, and that will continue. When we include the voice of consumers and we listen to what consumers have to say, we can improve our systems so that we meet the needs of our communities much better. And that includes when things go wrong. In fact, that's probably a key time when we need to listen very carefully to the consumer and their family. This policy moves away from looking for blame and holding people to account in very punitive ways. It's much more about understanding what's happened and what we can do in the future to make improvements. It also is a more just approach for the workforce. People don't go to work to harm their patients. They go to do good things. Unfortunately, it's rare, but it does happen that things go wrong. In those circumstances, we need to understand how the system got to that position and what we can do differently in the future.